PANDAS, and it is going to be a call you will never forget. We're so excited.
We're very excited. All right, so why don't we go ahead and we're going to start at 6 o'clock sharp. So we just wanted to welcome everybody to the Optimal Longevity Series, and then we'll do our disclaimer. We'll introduce our special guest, Dr. Kedar Prasad, and Dr. Corbier, Jean-Ronel Corbier, and Dr. Paul Corbier.
Very good.
Okay.
Well, let's get the disclaimer out of the way so we can start directly at 8 o'clock sharp our time. The statements this evening's and comments have not been evaluated by the Food and Drug Administration. This information is for educational purposes only and includes recent advances in research on micronutrients. Engage, the micronutrient company, does not claim that our products diagnose, treat, cure, heal, or prevent any disease or injury. Engage's products do, however, address our deficiencies and provide our bodies with the nutrients we are lacking. Nothing here is intended to be a substitute for the treatment or a visit to your primary healthcare provider. With that being said,
let's kick it off.
Let's kick it off.
All right. Welcome to the Optimal Longevity Series. And tonight we're going to be talking about PANS and PANDAS. But before we start there, I'm going to go ahead and pull up Dr. Prasad's bio, Dr. Court. I'm going to have you go over those for everyone. So we know, for people that haven't met Dr. Prasad, we'll go ahead and scooch this over. Can you read those, sir?
Parts of them.
Go ahead. There we go.
Well, it's always my great honor to introduce Dr. Prasad. Dr. Prasad was a professor at the University of Colorado School of Medicine for more than 30 years. He was the director of vitamin and cancer research. He was also the former president for 10 years of the International Society of Cancer and Nutrition. Dr. Prasad was personally invited to sit on the Nobel Prize nominating committee for candidates in medicine. He was also the world's first PhD radiological biologist. Side note, he beat all his other classmates by 4.5 years to be the #1 PhD radiological biologist in the world. Dr. Prasad has also discovered vitamin E succinate. It is an anti-cancer nutrition, as well as he discovered butyric acid, the small fatty acid formed by fermentation fibers in the gut, and it is also an anti-cancer agent. Dr. Prasad has co-authored or authored his 34th textbook, and he has listed in PubMed over 450 times. And I know I'm forgetting something, but you went off. He has over 350 peer-reviewed articles.
Papers in very prestigious journals such as Nature and Science. Welcome, Dr. Prasad.
Welcome, Dr. Prasad.
All right, Dr. Prasad, you're muted. Perfect.
Thank you, Dr. Court and Jeanette, and thanks our guests.
Excellent.
And I will do whatever I can, and if you have questions, I will be glad to answer that if I can.
Of course. Well,
and
first
if
of all,
I can't, I will look it over, and then next time I can answer it.
thank you. So with that, I'd like to, our very special guests tonight are Dr. Jean-Ronel, pediatric neurologist, and Dr. Jean-Ronel Corbier, pediatric neurologist. And Dr.
How do you spell Corbier?
Yes.
Corbier?
Corbier, yes. Corbier.
Oh, Corbier. Yeah, easy. Okay, now I understand.
And then Dr. Paul Corbier as an okay. Ladies, you're going to have to watch the moderation, please. Thank you. And Dr. Paul Corbier, internist. They we got to meet them in person at their amazing clinic in Indian Land, South Carolina. They run the Brain Restoration Clinic. And so if you wouldn't mind giving me a brief summary of the work you do there, and then let's just jump right into what is PANS and PANDAS. And Dr. Prasad, they're going to spend about 10 minutes walking through symptomology and where things are at to kind of guide us in the framework for strategies tonight. So if you wouldn't mind doing that, I'd appreciate it. Okay.
gotta unmute.
Yes, sorry about that. So thank you so much,
But-
Jed and Dr. Cord, and we're happy Dr. Prasad is going to help address certain key questions for us and for the audience. And we're happy that a lot of people have joined, including a lot of our patients. So we're thrilled. And the moderators, Beth and the others, we thank you for your service, an important job as well. So as Jet mentioned, I am Dr. Ronel Corbier, a pediatric neurologist, and my background is that I've been to a lot of different institutions, Johns Hopkins, Mayo Clinic, University of London, and other places. My goal was to understand the brain of kids, how it functions and malfunctions sometimes. And in this sense, we have a clinic called the Brain Restoration Clinic, and we work with a lot of different conditions. We're going to talk about one of them today called PANDAS and PANS. And when I say panda or PANDAS, do not confuse it with that special animal, that bear. That looks like it has a black and white suit and is super cute and cuddly. We're not talking about that. Yes, we're talking about a very serious neurological condition that affects a lot of kids. PANDAS is actually an acronym that stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections. I know that's a mouthful. Let me repeat that. It's Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections. So in essence, you have a young kid, usually prepubertal, let's say a 5 or 6 or 7-year-old kid who's previously healthy. That kid gets a strep infection, and then boom, all of a sudden, very abruptly, acutely, and dramatically changes occur very quickly, sometimes overnight, where that previously healthy child develops severe OCD with intrusive thoughts, obsessions, compulsions, or tics, motor tics, vocal tics, eye blinking, throat sounds, and other things that could be very, very disruptive. In addition, these kids can develop changes in their mood, emotional ability, depression, anxiety. And when I say anxiety, this is new onset acute anxiety, so severe that the kid may no longer be able to attend school. The kid may be very irritable, aggressive, may have cognitive, academic decline, changes in behavioral or developmental performance. So it's almost as if the kid were a different child altogether that the parents no longer recognize. The reason we're talking about this condition is, number one, clinically, this is a condition that causes a lot of distress for parents, for families, but the mechanism of action is very important to our discussion this evening. So PANDAS is one term. The other term is PANS. PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. The difference between PANS and PANDAS is that in PANDAS, the first condition we just mentioned, it is triggered by strep. Whereas with PANS, which is related, it is triggered by another agent, another organism like Epstein-Barr virus or something else. But in both conditions, changes are very acute, very severe. In the case of PANS, you may also have very severe food restriction. I don't mean just being a little picky. I mean sometimes being so severely restricted that some of our kids have ended up in the hospital or getting feeding tubes in the more severe cases. So we're dealing with a very traumatic condition. So that's PANDAS and PANS, which can occur in up to 1 out of every 200 children. So suffice it to say that there are many kids that are not diagnosed, or if they do get diagnosed, they're diagnosed late because not all of the providers understand this condition. So moreover, with PANDAS, we think that there's an immune dysregulation that affects a part of the brain deep down called the basal ganglia, where changes can result in OCD tics due to an abnormal altered immune response. And newer studies also show that the gut microbiome can change in such a way to cause inflammation. So Brother Paul, did I forget anything, or do you want to add to that?
Well, you were a little long-winded, but that's all right. I want to hear Dr. Prasad answer some of our questions. No, just kidding. Well, let me just also say, what are the treatments that we're doing so far? And if they weren't limited, we wouldn't be having this discussion. So, but let me tell you, the standard treatment for There are several modalities of treatment for PANS, PANDAS, and let's use one term, PANS, PANDAS, as just let's look at it in one entity. Are first antibiotics. My brother mentioned streptococcus, one of the bacterium, as an inciting factor, because a number of infections could do this too. So antibiotics is part of the treatment, but the only problem is the antibiotics are not the most friendly to our gut. So that's a big problem. It can disrupt things, microbiome, making other aspects of health worse. Two, there are what we call immunomodulatory therapies, like steroid therapies, even IV therapies, immunoglobulin to just replace more defective immunoglobulins as a reboot. That's very costly. Not too many people are lining up and say, I could pay 20, 30 grand just for that type of treatment, which has its own side effects. Then when it gets bad with all these symptoms we talk about, there are psychiatric concerns too, anxiety, this and that. And not everyone is eager to take psychiatric medications like Zoloft, SSRIs, and therefore, and even those who do, sometimes they may have side effects and may not tolerate the med. So they'll ask, what else can we do? Any alternatives? That's an important question that we want to answer. And sometimes we have to refer folks to the counselor if their OCD is really bad or they need some support counseling. But some of our kids can't even sit down in a civil way with the counselor. They need some other better interventions to stabilize them even before considering that. So these are therapies. Our question will be, is there something else we could do, some alternative that supports the body rather than throwing an extra medication that may or may not be tolerated?
And so before we get to some specific questions for Dr. Prasad, I want to say that PANS and PANDAS, even though it's a very specific condition, it overlaps with a lot of conditions that we see in kids and adults. For example, we talked to this group last time about autism, and Dr. Prasad was kind enough to answer our questions and come up with some very good scientific explanations. Well, autism and PANDAS have a lot of overlap with immune dysfunction, inflammation, and so forth. So what we're discussing today has broad implications. Do you think for adults as well?
Yeah, so for adults, some people are asking, why do I need to listen here? I don't have PANDAS. I'm an adult, and this tends to be in the kids. But for one thing, your grandchild, grandson, some relative, some friend, their kids may have this condition. So we hope that you'll listen in. And the other thing to consider is some of the adult and even geriatric neurodegenerative conditions. Just today, we saw someone with Parkinson's disease, and I believe Dr. Prasad wrote a book on Parkinson's disease and some of these conditions and Alzheimer's disease. We think that using the same comprehensive approach and questions that we'll ask about PANS and PANDAS can also apply to these other conditions that you may be more familiar with.
Yeah, I have one question.
Yes.
This is due to infection, whether it's streptococcus or some viral or some other infection. So apparently healthy children suddenly gets infection and develop these symptoms.
Yes.
Yes.
But in the brain, they have figured out in brain that it is for example, by PET, that they are inflamed or the infection is there or not there anymore?
Yes. So for example, strep is very, very common in kids, but there's a subset of kids that have a change in their immune system so that the immune system responds in an altered way. So when that alteration in immune response occurs, there are cytokines and other signs that cross the blood-brain barrier and attack dopamine receptors D1, D2 in the basal ganglia, causing all of these symptoms. So a lot of studies are looking at genetic susceptibility and other things, and like I said, the microbiome. So that's what's happening. So that's why the immune system regulation we think is very important.
And sometimes we can measure these autoantibodies attacking specific parts of the brain.
But how about anything wrong with the intestine?
Yes, so they're finding now that the change in the microbiome can favor neuroinflammation, and they've measured oxidative stress biomarkers in kids with PANS and PANDAS and related conditions, suggesting that a change in the microbiome can be a trigger or a factor in the development of PANS and PANDAS.
And so we hope you can address that, because we feel that that's missing.
I just trying to understand the ideology that why it happens, and obviously, if to get into the brain barrier has to be damaged by the infective agent or overstimulation of immune system that produces a instead of anti-inflammatory, pro-inflammatory cytokines, and that can damage blood-brain barrier and then facilitate the entry of the infective agents.
Yes.
Okay, so understand.
But it could also be the dysbios, and we'll get into this more. The dysbios in the gut microflora could lead to more of a lipopolysaccharide, which is
Yes, induced, yeah. So
which
it is a
can cause
consequence of the
lipo-
disease. In other words, like, generally for old people or people who have Parkinson and this thing, this is a endogenous. In other words, they exist in the intestine already, intestinal dysbiosis. But in this scenario, it is induced by infective agents and some other changes
Yes.
that occur.
As a trigger.
Because now person can't eat, can't do this and that. So it is the consequence of the disease rather than causes of the disease, PANS or PANDAS. And so this is very interesting that once you develop it, then you have to correct it. Yeah.
Yes. And yeah, so we have a couple questions for you now.
Sure.
Oh, we have questions now. So yeah, go ahead. You want to ask the
So,
first question?
What we'll do is I'll ask a question and my brother will ask the next question. So the
Okay.
first question is, we talked about PANS and PANDAS and the neuroimmune aspect of it, the neuroimmune dysregulation. So the question is, how could supplements like Micro Daily be used? Our concern is the traditional treatment for this often involves antibiotics that can disrupt the microbiome or steroids, which can work but has side effects. So how could products, Engage Global products, Micro Daily, help with some of the symptoms of PANS and PANDAS with regards to the immune dysregulation present?
Yeah, I think, from the symptom point of view, I was looking into it, and there are three issues involved. Consequences of all this ideology that you mentioned, and is the increased oxidative stress one, you mentioned it, inflammation, neuroinflammation is another one. And the third one is also that increased release of glutamate, which makes your psychiatric behavior is very common in the autism as well as the symptom that you described about the PANS or PANDAS. And so I think, so the question is how we can reduce all three at the same time, not one after another.
Right.
It is important. And so it is known that, for example, Micro Daily EMF, if it is a kid of 7-year-old, I would say that use the hydro, and hydro would be half the dose that adult dose is for 7 people, 7 year, say between 7 to 12. And after 12, you can use the full dose, preventive dose. And I'm not talking about therapeutic dose. Therapeutic dose apply only for cancer. And so in this case, so that would be one. That will decrease the both oxidative stress and inflammation. But it also, third thing will do, suppose by the time you have getting this treatment, glutamate, is excessive amount of glutamate is already released. And as you know, in outer space, they're very toxic to neuron. So neuron will be dying. So you have to take care of that one as well. And and it has been shown in experimental system by many investigators that antioxidant block the toxicity of glutamate. So since micronutrient, the hydro has a EMF hydro, has the antioxidant, they will block also the toxicity, potential toxicity, already released glutamate. Now, third thing is how you prevent the release of glutamate. Not only that, how do you feel calm and quiet, and how do you make him quiet and good quality of life. And for that, I think that for one very non-toxic way is, for example, if it's a kid, 7-year-old kid, say, for example, 100 milligram of CBD. CBD has 3 very, very important functions.
And Dr. Prasad, before you go on, yeah, that's going to be one of our next questions, because I want the team here, the group, to know that they do have a lot of behavioral problems.
Yes.
So I'm really interested in hearing about this CBD, how it's formulated and how it can help with behaviors, because a lot of our kids have meltdowns, anxiety, mood. So yes, that is one of our questions. Tell us a little bit about the CBD.
Yes. CBD, we have a, as you know, that CBD could be isolated from a marijuana plant. And also there is a plant called Hex plant. Marijuana plant has a 20% CBD, but the plant that our company has worked with is a only 0.3% has a THC. So it is almost THC free, but then it went through a lot of purification. So we can almost guarantee, it is third-party tested, that our CBD has no trace of THC, because THC is an addictive drug and it can also interfere as a chronic issue, a function of the brain. And so that's very important. And so we have a very purified crystal of CBD. It has no other, like many times people use all kind of CBD oil, CBD. There are many different, when you examine, just isolate the CBD, it comes out many other things with that. Some are aromatic compound with nice flavor, nice smell, but our is pure CBD, no trace of THC or any other contaminant. So that is purification of CBD. And people who are using CBD for various reasons, even for behavior, in some cases autism as well, that they have markedly improved the behavior. And so here, even some people have a chronic anxiety or depression. And these are, again, very common ones. But here is the way CBD works. I think probably, is that it acts two ways. First, it acts as a serotonin reuptake inhibitor. And serotonin reuptake inhibitor, a drug has been developed on that, also as an inhibitor of serotonin reuptake, approved by the FDA. So drug is used for people who have anxiety and depression routinely, but it has toxicity also. But CBD has no toxicity. As you know, FDA has approved up to 750 milligrams to give the children with seizure. So it is very non-toxic. So people start like 100 milligrams, and as you know, as a doctor, you can do 150 milligrams. If it doesn't work, you can go very easily up to 200, 250 milligrams for children who has this kind of acute issue. And so one function is this. Second function of it is that it also directly activates serotonin receptor. So it not only prevents the reuptake so that it doesn't get metabolized, but it also provided a new molecule of serotonin. And serotonin, as you know, it has very calming effect. And also it stimulates the production of GABA, which is inhibitory. So if you have a hyperactivity, and now you not only have increased the serotonin, but also increase GABA and prevent the release of glutamate. So you can see that how hyperactivity can be dramatically reduced. Another way you can change the behavior of the CBD. CBD also increases the dopamine receptor. So it transiently increases dopamine level as well. And as you know, increasing dopamine level makes you happy. And so with all these at least two things, and then since they have developed now intestinal dysbiosis, I would say also use the probiotics that we have. And it is very important to remember, probiotics, if you have just, like yogurt, you have just the 2 strain, Bifido, a strain of bacteria, 4 or 5 different strains, and lactobacillus, which are very beneficial bacteria. They generate a lot of short chain fatty acid like butyric acid, vitamin K, B vitamin, neurotransmitters, so produce good. But if you take orally them, then 60 to 70% are destroyed with acid pH. And then enters into intestine, small intestine, where there is a bile acid, further destroyed. So by the time it goes to lower colon, there are very few left to form a colony. So it is not as effective, maybe some effect. And so we added 2 additional strains in our preparation, which are acid resistant. One is the Bacillus coagulant, and Bacillus coagulant is the only probiotic that has been approved by the FDA to be given in an infant formula. Because as you know, infant, you know better than me, are sterile. So to prevent any toxic bacteria entry and take a hold of in the gut, they use this Bacillus coagulant. And then another one is Saccharomyces boulardii. This is derived from the yeast. And they are also, and clinically they have been shown to improve intestinal inflammatory bowel syndrome, many kind of intestinal issues involved clinically, both Bacillus by itself and the Saccharomyces boulardii by itself. They try that, that's very interesting. In a clinical study, people always try just one agent at a time, never address the whole issue that we have a multiple. Nobody has a single defect. You have multiple defect. And if you don't have a multi-defect and multi-approach, nutritional approach, you're not going to be, you will be some effect, but not very much.
Yes, we agree with that. Mhm.
With behaviors, because we're certified in sleep medicine, we know just from all the polysomnias that these PANS and PANDAS have, the building blocks for the tryptophan to make the serotonin to melatonin, and also the GABA should be made in the gut. And so, and having that CBD, that could very much be very helpful for behaviors, really addressing that.
Very important for
aspects.
behavior.
Because
Yeah.
they're violent sleepers, night terrors, they have a lot of sleep issues. And when we don't,
Yeah.
I think that those could be very helpful by rebuilding.
They're all linked. They're all linked, And so CBD is one of the very few agents that had worked at the multiple sites to help you. And as you know that, in India and many other countries, people have used different form of marijuana
Yeah.
for many reasons.
Well, yes. So yes, I really like the way, yes. So I like
But
the
now
way
we
you-
know which is not as good for long-term
Sure.
chronic
There's
issue.
something else.
And for short-term, like somebody uses marijuana. A friend of mine was using short-term because he has some problem. And but again, the short-term is okay, but long-term, I think CBD, no matter how long it has non-toxic, non-addictive.
Yeah.
Yes, we
And
just,
And CBD isolate, right? And I think
Yes,
Yes.
CBD, that's what I'm saying. It is purified in crystal form. It is not a all comprehensive, yeah. So I think it is CBD. I have reviewed many papers, and CBD looks like the most effective form in terms of reducing inflammation, also through the immune system.
Yes.
yes,
It
that's
can
very-
even in autoimmune disease, you can prevent or reduce the deregulation of immune system.
yes,
So it has a lot of things, and so is the intestinal dysbiosis. If you correct them, you also have a big impact on immune function.
that's right.
Yes.
And so it is, since it is induced by many other agents in the children, and then you have to take care of that. So we recommend microdaily, CBD, and probiotics.
Probiotics, yes. And just before this call, we got off the phone with one of our long-term patients that we've seen for many years.
Star patient.
Yeah, a star patient. And this patient had a lot of severe neurobehavioral problems, cognitive speech, and went on the boost, CBD boost, and starting to do well, but then we went up on the dose. Like you said, Dr. Prasad, we need to not be scared to increase the dose because it's very safe. And we got testimonial from the mother that, wow, the kid's different, different kid, the behavior is much better, speech, language, cognition. So we believe in that. The other thing also from a PANS and PANDAS perspective is you talked about the GABAergic, serotonergic, and dopaminergic aspects that are all important and which are relevant to our PANS and PANDAS patients. So yes. So our next question is, these kids, not only do they have acute onset
Well,
symptoms.
before we finish the CBD, someone I see was asking about when is the best time to take it? And as we were saying, we started a lot of times at night to also help with the sleep, as you were saying. Then
and you can take any time. You can take morning, noontime. But if you have a sleeping problem, take half an hour or an hour before they're going to bed.
So, yes, so that
I
leads.
mean,
to-
the reason is in the evening is better because sometimes you get too relaxed, but kids don't drive, So
Yes.
for kids, it will be okay. Doing a daytime, maybe a split of the dose, half an hour, but these are all because we don't know for sure what is the best way. And you as a physician, you can do this, They say, okay, try twice or try one time and see how it works.
Mhm,
And
yes.
1 week, you see the result is so acute. You can see the result in a 1 week.
Yes, yes.
That's what we're hearing. Yeah.
Yes, and that leads us to our next question, Dr. Prasad, because with PANS and PANDAS, not only is there an acute onset the first time that is very abrupt and traumatic, but there's kind of a relapsing, remitting pattern where kids get better and then boom, they get hit with a flare and then they have severe behavior and other things. So what can you say about nutritional health for acute flares that can occur intermittently?
Yeah, but acute flare happens because you have not taken care of all these issues that is working. And you are trying to take care of one issue at a time. Our approach, if you give a micro daily probiotics and CBD, that should not be a flare-up.
Yes.
I mean, I just predict based on what the action is. If they are all working together, then it won't be any flare-up, in my opinion. But if it does happen, then let us discuss it, what we can do further.
Yeah. And how long should some of these products be given in general?
I mean, you can give as long as the symptom lasts. And once this, suppose once the symptom is cured, and I think I would say that even after curing, you complete 1 year because you want to give a chance. Brain has also tremendous capacity to regenerate in the beginning phase, especially in children. And so you want to see them fully recover. And but as soon as the symptom is gone and next day you stop these things, that won't be any good. But at least micro daily EMF, and he can continue for as long as he feels comfortable.
Yeah. So in our pediatric patients, we're always concerned about efficacy, making sure that the treatments work, but we're also concerned about safety issues. Can you address safety and any side?
Yeah, none of them that we are recommending. It has a safety issue. For example, micronutrient, that's why we give half dose, not full dose. Even full dose, there is no toxicity issue in these kind of acute cases, but we are cautious. Only half the dose if the children is 7-year-old. And the probiotics is once a day, probiotic 1 capsule a day, and the CBD either once a day or twice a day, depending upon how you want to do it, how the children feel. If you have a sleeping problem, you should do in the evening. And so it is very simple procedure, really, if you look at it. And kids can eat it because sometimes suppose kids can't swallow it, for example. All these things, you can just open it and mix something that kids like it and feed them. It is same. You don't have, that's the reason we develop a hydro.
Yeah.
But suppose in CBD, some kid doesn't want to swallow the pill. Then what you do? You don't want to force it. It has the same effect. You open it, put in a yogurt or something, some sauce, apple sauce or something, mix it and drink it.
Yeah.
Same thing is CBD, is probiotics. It doesn't have to be in a capsule.
Yes, that's right. Yeah, and again, with our kids who've been on antibiotics for so long, we do think that they need support with probiotics.
Yeah, I think, I think so.
Stereotypes.
It is very important because, as you know, the antibiotics, now so sometimes if you have acute, so for example, infection of a streptococci or any kind of infection, a short-term antibiotics should be okay. But then you have to replace them with a good probiotic so that all these good bacteria is also dead with bad bacteria. So as soon as possible, you have to restore them. But many people don't care. They said, well, naturally they will restore it. Naturally they could restore, but may not.
Yes. And, we use a comprehensive approach too, in terms of even looking at extra ways to support the brain. So we know you formulated a product called Brain Boost, and
Boost,
we
yeah.
like it. And
I
even
think
Omega
again,
2s. Could you
again,
say
if you
something
can
on that?
afford it, if family can afford it, and Brain Boost is same thing. You don't want to, oops. What happened? That the capsule, the little capsule is a little bigger, Brain Boost. And so you can open the content very easily to open the content, mix with the sauce, apple sauce, or any kind of sauce that kid likes it, and take it. Brain Boost will be very, very essential during the phase of when you are trying to build up the brain function, to normal level, because it has certain things that microdaily doesn't have. It has, for example, the curcumin and resveratrol. It has a very important thing. It is because, as you know, membranes are very susceptible to damage from oxidative stress and inflammation. Very susceptible. And brain has the highest number of membranous structure than any place else. So so the membranes are getting damaged. How do you increase them? So the new brain membranes are formed. So we added a 2 precursor. One is a phytotidyl serine, and one is phytotidyl choline. And these are membranous precursor. And so now new membranes are formed. You're also giving an antioxidant, so they get protected. They don't get any more damaged by. And so I think Brain Boost that we have, I think that will be very useful in this scenario because here mostly brain is involved.
And a word on omega-3, the omega-3 products.
Omega-3, well, again, omega-3 is so important for your function, and especially brain function, and because 40% of the brain fatty acid is DHA, which is one of the components of omega-3. 40%. That means brain needs a lot of omega-3. And when you get it diet mostly you can get the alpha ALA. That's the only thing you get from there, from the vegetarian diet. But meat doesn't have very much. Fish nobody can eat every day. And so and see the rate of conversion of alpha ALA to DHA is very small, slowly. And so the best supplement would be what we have, omega-3 fatty acid. And
just
so again, omega-3 in this scenario, omega-3 would be as important for brain function because we are focusing on brain function right now.
Right. Yeah.
Just suffering from oxidative stress, inflammation, the excessive release of glutamate and so on. So that's why we have to do all at the same time.
Right. We've found that the greatest success for those that are targeting all of these aspects, the gut.
Exactly, all pathway. Otherwise, if you do one at a time, sometimes in clinical study, that's amazing. I was trying to review the paper. They just do one probiotics, only one probiotics use it.
Like S-fluoride.
Yeah. And that probiotics, which is destroyed, in the gut, and then they said, there was some effect, but not very much. What do you expect?
And lifestyle too. I think what you're saying is wonderful with a good lifestyle, trying to
good lifestyle, of course. We always, and as a
right.
physician, you are expert in that. We always emphasize, try to make a good diet as much as you can. Fruits, vegetables, low fat, but in this scenario, at first you have to take care of all these symptoms. I don't know because you mentioned that even they can't eat very well.
Right, that's true.
And so, but as much as you can, feed them a good food if you eat, and you will see that within a month the whole future will change, and he will start eating it. And when you start eating it, then you start giving a low fat, high fiber diet, and all these kind of good food, fish, less meat.
As you were talking, Dr. Prasad, I was thinking of the synergy of using the different supplements together to cover a large range.
Yes.
Yes. Even when it comes to medicine, there's a concept of monotherapy using one drug versus what sometimes we call polypharmacy. The problem with polypharmacy is when you have multiple drugs, you get side effects, although sometimes it's rational polypharmacy. But with these supplements, they're safe together. I would imagine there's a synergy and covering, multiple domains. So
Yeah, multiple domain is all safe.
Yeah,
safe, yeah.
so we have a different type of question now that we've been thinking about, because we're trying to look at all aspects of this. Our kids are very sick, some end up in a psych ward, whatever. So we want to look at all aspects. And one of the things that parents tell us is to pacify the kids, even as we're trying to provide good treatment, good supplementation, et cetera, that they use their gadgets, their cell phone, and so we're concerned a little bit. You're the expert in terms of exposure, radiation.
Yeah,
What can you
EMF,
tell us about
yeah.
the role of digital hygiene in this?
I think, one good
Does
thing
it
about
matter?
it that if he's taking a supplement that we recommended, especially micronutrient, they will reduce the potential damage. You can't take away their cell phone. It is not possible.
Okay,
That will be
we tried, but it
take away
didn't work.
forcibly. This will put extra stress, and you don't want to do that. But
Okay,
what you want to do that, reduce the impact.
okay.
And he always, Janet always mentioned PAMARA, which I propose with respect to ionizing radiation, protection as much as reasonable, achievable. And that's what you can do in case of EMF radiation from cell phone to computer, you can't take away.
Mhm.
And if you
You're
take
saying
away,
these
you put
products
extra
protect
stress on their brain.
Mhm. So it
Fortunately,
offers protection, cellular
you try
protection.
to educate them to use as little as possible.
Mhm,
When you do it, so you try to persuade them to use less.
mhm.
And there if you succeed 20%, you are ahead of the game.
Okay,
So that's what they're proposing with respect to that, the radiological concept that throughout the country or world adopted as low as reasonable, achievable.
mhm.
That means radiation, when you are working in radiation worker and then doctor, radiation worker and radiologist, so they adopt this concept that try to expose the patient as little as possible. But that's concept, physical concept. Biological concept is that we are proposing it.
And I think this is really an important piece, is that focusing on when we sleep, because that's when we heal. And so setting clear boundaries, like we know that for schoolwork or during the day, but at night, really setting good safety hygiene, good EMF hygiene at night.
Yeah, for example, just like
that-
Dr. Cote always mentioned that, in the night, that family who has these issues, they can turn off their Wi-Fi. You don't need it. Those things can be done without any stressing the kids or adult for that matter, but especially kids, and try to persuade them that it is not very good. Try to use it, but use it when you need it. You don't go and just beside when you go to bed with cell phone beside you. That they can do it. So in other words, use it as little as possible and try to persuade them without offending them.
So Dr. Prasad, would you say that PAMARA, so ALARA is as low as reasonably achievable, more of a shielding
Yes.
for radiation, but PAMARA is really a new concept, novel approach that you
Yes.
have written about. It could be both for taking the micronutrients twice a
Yes.
day and protecting from the inside out, but also biologically just setting clear expectations that at night we don't need to have that technology on, so that we
Right,
can
exactly.
right? So that would
And-
be a PAMARA type of approach.
And here, why micronutrient that we have, the EMF hydro can also help, because Dr. Cote has extensive experience in this area. Because they also, just like ionizing radiation, X-ray or gamma ray, they also produce free radicals. One. Second thing that ionizing radiation does not do it, that it vibrates the charged particles. Like if you have in our body, there is all time positively charged particles, negatively charged particles floating around our brain. When they have, then this EMF radiation will oscillate them, vibrate them. And in vibrating states, it interferes with the communication, especially in the brain. Communication, electronic communication can be disturbed if you are vibrating it. And so what antioxidant does it tries to neutralize by donating extra electrons. Suppose you have negatively charged particles and they are vibrating. If you are taking antioxidant, they can donate electron, you calm down, becomes neutral. And that's why Dr. Court, in his experience, when patients which are super sensitive to EMF radiation, when taking micro daily before coming, then they don't have symptoms. Is that Dr. Court can expand more on this issue than I can.
Well, I think that, it certainly helps to decrease the symptoms. I actually was thinking about a question regarding the omegas and taking those maybe more than twice a day to decrease inflammation.
Yeah, I mean, again, it is non-toxic. Again, like I said, the doctor says, well, one is not working. Let me try two, because as long as it is within a non-toxic region, this is okay to work with. And so again, there I have no experience in, but suppose Dr. Corbier has tried one capsule a day, for example. It is so. Let me try 2 capsules a day. For children, I'm talking about it. And again, this is absolutely essential fatty acid that your body doesn't make it. So it is no toxicity.
Yeah.
As a matter of fact, go ahead.
Well, that's measurable. I mean, we can
Yeah,
do a
that's what I was gonna
comprehensive
say.
omega, right?
Yeah, exactly. So I mean, when I say something, it is my guess, but in actually working condition, you and other doctors, they have more experience. So, and I value their judgment, and I have no problem.
Yeah, so it can be measured and some
Yeah.
very low level, so that helps guide.
Yeah.
Dosage and so forth.
So, but except to say that it is absolutely essential, the omega-3 for brain function, and it is very important to have that.
Mhm.
One capsule, you can have 2 capsules.
Yeah, so I think it's important in situations like this and with our PANDAS and PANDAS to monitor carefully. And as we treat and we use a particular dosage, if they tolerate it well, but they seem to need more, product, then we can go up appropriately.
Exactly.
Just to make sure.
Because the dose range is so, 2 times more, doesn't have no toxicity.
Yes.
As long as you are working within a non-toxic region, you are okay.
Okay, yes.
Because patient, you observe the patient, I just making up a hypothesis.
Yes. And so that EMF, that seems to be a very important issue.
Very important.
Yes, we talked about, microbes, toxins and things, but sometimes we ignore the impact of EMF. So to know that there's a product out there that orally can help protect, that is even in the name of the product, microdaily EMF, is very exciting. And I think that's a very key thing.
And that's why we gravitated to these products, is we don't know that there are others out there that really target that support, that cellular support. Am I correct?
And we perform a lot of clinical study, like probably you are aware of. It took 6 years to develop the original product, and then we modified it as we go along for the advice of Dr. Court. That when EMF became an issue of, then I said, okay. And the only reason I have not published much of EMF, because I have a manuscript ready to go, but because this is pending in patent, and when your thing is pending, you can't publish anything.
Well, we'll just keep collecting that so that as soon as it's patented, we'll be able to put out that 35th textbook.
That's right. It's patented. I think we have already submitted it, for example. That's interesting in how patent works. Gummy has been approved, gummy, which is also micro daily, but for children, lower dose, much lower. But so on the back of gummy, what they call a CPI. So lawyer decided that if you have one already approved, the cousin, in a way, which is a omega, which is EMF, would be approved without much problem. And so I think within, I would say maybe 3 months, we should have that approval for EMF.
That's great. Yeah, we're looking forward to that very much.
Yeah, because EMF is also, the gummy is already done. We have also submitted for a probiotics and also omega-3.
Okay. We also like the biochemical individuality aspect, because some kids have mutations in their DNA or in their gene SNPs like MTHFR, where they may not tolerate certain types of B vitamins. Others, they may be okay. So knowing that the hydro and the microdaily EMF, that there are these variations so that someone can take the appropriate dose that fits their biochemical and genetic makeup is very exciting.
Related,
Yeah, that's good.
And I think that, getting, as we're getting closer towards the end of our call, but digital hygiene, as you had said,
Mhm.
Dr. Corbier,
Very
is
important.
really, really important. And when we're looking at
Prevent
digital
any
hygiene,
infection or any kind of things, good hygiene is very important especially for the kids, also for the adult.
right? But digital hygiene in our clinics,
Yes,
for the doctors to become aware of this new concept
yes,
of trying to reduce, again, Primara within your clinic to reduce, the EMF within the clinic, I think is very important. And then teaching that to the families about reducing the EMF in their home, step by step, and then monitoring the behavior of the child, monitoring what we see. This is totally new territory.
I know.
In the world of EMF and in the world of PANS and PANDAS, no one's doing it yet.
Yes.
This is the first clinic that's going to be taking that on and starting to reach that frontier, both in the clinic and in their homes.
Yeah.
Mhm. Yes, and I think we want to take that very seriously too.
Yeah, and it does
That's-
not interfere with your routine use or
Mhm.
benefit of this technology. You
Mhm.
just have to reduce as much as you can, like
Yes.
alarm.
Yes, the exposure.
And
Yes.
then you have Pamara that you take micronutrient, then it further reduce the damage.
Mhm. Yes, covering all.
And we're
the
going to
bases.
use Pomara both in regards to radiation and then in regards to in our clinics and in our homes.
Yeah,
Mhm. Yes. Yes, we definitely agree with that, and we want to implement that much more than we have been.
Well,
Yes.
and for people on here, at night, like when we measure sleep, for some children's brains, it doesn't take much of exposure to really affect restorative sleep. It could be a very small amount, like 0.005 watts. And plugging things, reducing electric exposure, all the bees in the room, turning off the routers, all of those,
Unplugging the routers.
I'm sorry, unplugging the routers, all those things are measurable. And when we are, the quality of sleep and having a cool brain and a cool body so we can get to restorative sleep. If the child's hot, it's hard for them to get to that restorative sleep. So I think there's a lot of things we can work on this space so that we can really help them. I do have, when I was reviewing for this call, the seriousness of the sleep issues and the polysomnias. No matter what we do, even if we get good, we have to really focus on that because they're going to have a lot of behavioral issues with the quinolinic acid as one of the byproducts. But what I'm excited about Dr. Prasad's work is that we're really working on the dysbiose and then the communication back up to the HPA. And for the parents on here, simple strategies for restorative sleep could make a huge difference in behavior.
of
Right?
course. Sleep is very important for your brain.
Yeah. And the way we're designed, when we think of the neurotransmitters, neuromodulators, different
Exactly.
ways of the sleep is very important. So to have those modulated, work with the
And
body.
again, all these kind of strategies that we are talking, simple thing to do is simple to implement it, and it can increase even for adult.
Yes.
And even modulation of things like cortisol, norepinephrine, and other things that are changed or altered during non-REM versus REM sleep. Just getting good, high quality of sleep can help regulate these things.
Yeah,
In addition
yes.
to nutritional, supplementation. So that should not be ignored.
Yeah.
Yeah, I think that's true.
So
We've
you've
just got
answered all of our questions.
We've got a couple more couple
Oh.
more minutes with Dr. Prasad before he heads
Right.
out. Would you like to
Good.
go ahead and ask him anything
My
else?
family is coming. I cooked some Indian
Okay.
dinner, so my family is coming. for
Good.
dinner.
Yeah, we got all of our questions out from our
Yeah,
end.
well, just one more real quick, if we have the time for one more. We talked about different supplements, brain boost, CBD. Can you talk about collagen briefly and how that may
Yeah.
impact
Collagen is important because especially, for young people, collagen is not as important, for 7-year-old kid. But as we grow older, for example, and then loss of collagen occurs, we can see in the skin, but loss of collagen occurs in a brain or a heart, you don't see it. And 30% of body's protein is collagen. That means it is present every place. And especially collagen 6, type 6. There are 28 different types of collagen. Collagen 6 is present in the neuron. It is neuroprotective agent, collagen 6. So if you collagen down overall, because you are getting old and you didn't do anything to restore it, then the collagen 6 will go down and then your neuron becomes more vulnerable. And they have found out that, in a case of Alzheimer's disease, the collagen 6 binds with the beta amyloid protein or make them inactive. And also, as you in these kind of diseases, by PET scan, they found that brain shrinks certain area of the brain. And when they did a clinical study with collagen peptide, they not only restore the original shape of the brain, but also improve the cognitive function. So collagen for us adults is extremely important for improving the brain function, make sure that brain doesn't shrink, and maintain a good functioning brain. But also, collagen peptide has additional function. For example, in case of diabetes, and because it improves the secretion. What happens in diabetes? There is an enzyme called DPP4. When it increases, this flow of insulin from pancreas to the blood slows down. So company have developed an inhibitor of DPP4, and that is in a clinical use. Doctor recommends it. But collagen peptide does exactly the same thing. It acts as an inhibitor of DPP4 enzyme and allows the flow of insulin with no toxicity. And so collagen peptide is not only makes you look younger, but with kidney function or with the heart function, it is very important to have collagen, because in the skin you can see it, but in other part of the body you don't see it until you do PET scanning. And you won't do PET scanning until you have some kind of problem. By the time it becomes too late. So from prevention point of view, I think, I came to know very late, but still my brain is functional, but at my age. But the thing that if I knew earlier all these things, then I would have been much better shape. You people are younger. So
Well,
So
I
you
think it's
can-
still pretty good for 89 years young.
I know. 89 plus now.
We'll continue to carry the torch.
Yes,
But we need to let Dr. Prasad.
we do. We need to let Dr. Prasad go. Thank
Yeah.
you, Dr. Prasad. And we'll just, everybody else stay on. We're going to close the call, but thank you, Dr. Prasad, and we'll.
Thank you very
We'll
much.
see
Thank you, Dr. Prasad.
Thank
We
you for your
appreciate
time,
it.
Dr. Prasad.
Bye.
With Dr. Corbier's,
Okay,
Bye-bye, Dr.
thank you.
Bye.
Wow, that hour went quick.
It sure
Sure
did.
did.
I would like to ask, what do you think the most important thing for people on here that may be like symptomologies that could help, again, repeating some of the symptoms that the children may have, so that they can, maybe they're getting misdiagnosed, do you know what I mean? And for us to look at, close with that, and then we'll wrap up the call.
Well, I had a question before we close.
I know.
Dr.
Hang on. Go ahead.
Yeah, I'll start, and then my brother can. So a lot of kids have problems with emotional regulation or attentional difficulties or mood changes, motor problems like tics. So all of these are based on neuromodulation, neurotransmitters that, if properly regulated, and also if you control inflammation, which is a mechanism of action for a lot of problems, you can then see a translation in better symptoms, better function, which means better quality of life. So a takeaway message here is we want parents to know that there's a safe way, effective way of controlling these behavioral changes, which are very severe. So these things can be reversed with the right type of safe treatment.
Yeah. The only thing I'll add there is not to give up. I think we're onto something great. And we're beginning to hear from patients who have been on some of these products as a missing link in the PANDAS world. So we're very excited. When we have started one particular product or the other, we haven't always gotten the results until we worked a little bit more, tweaked certain things, went up if we had to on the CBD, whatever tweaks we needed to do addressing the gut and lifestyle. And so we're seeing that breakthrough with that kind of effort. It's not an overnight thing at all. It takes work, discipline, but again, EMF exposure, sleep, everything we've been talking about is critical. So if all these things are taken seriously, we then see decent results over time.
Excellent.
Have you seen any changes with the, what I thought that was really interesting on the collagen, and have you been using the collagen in the children, and what kind of things have you been seeing? Because I'm thinking about brain repair and the use of collagen with that.
Yeah, so the reason I asked Dr. Prasad about the collagen is because what we're finding is when we put together all of these products, I think we're seeing better results than if we just haphazardly use one or two products. So the collagen, we think, is part of that whole picture, like Dr. Prasad mentioned, neuroprotection. As you know, there's oxidative stress-free radicals, so any neuroprotection could be very useful. So that element of the collagen peptide, in addition to brain boost, CBD, and things, we think that that synergy is very important in better regulating the multiple dysfunctions that we see in kids with PANDAS, and other conditions like ASD. So, but we're studying it more too, and plan to have protocols. That's one thing together we would like as a team to work on, is different protocols for these conditions.
Yeah, and admittedly, it would be in our older patients or even the young ones, let's say teenagers and above who are still suffering for some time. We want to see what the impact of collagen peptides specifically and might be. If they're much younger, we probably wouldn't necessarily start with the younger age group.
Although we have a lot of connective tissue disorder patients, CDS and others, would be interesting to see how the collagen might fit into that patient population.
Well, I think it's Dr. Prasad's multi-micronutrient approach, which is his novel approach, and where most of the research that's out there is really on one probiotic or like vitamin C, or but when he's put this all together in the synergy, but really looking at now the unique mechanisms of action, which he documented last week with your autism paper when we were on last month, and then also with his peer-reviewed paper for diabetes, and walking through the mechanisms of action for those different products.
Yes.
And I think that that's going to be really dovetailed into the work with PANS and PANDAS to be able to look at that synergy and really the different mechanisms of action, not just the oxidative stress and inflammation, but the lipid peroxidation and issues with quinolinic acid and dysbios in the gut. Really tackling all of those things could really make a huge difference for the people on this call. And I'm excited for the parents and the people on this call. There are a lot of people that have children in their immediate spheres that have these types of behaviors. And now, and they've been misdiagnosed. And so I think we're really, getting closer to be able to get some protocol path forward to help them. And I want to thank both of you for that and your work. I mean, this work is really, really important. So
yes, and we appreciate the collaborative work. It's beyond any one person. So the collaborative work, I think, is very important in addressing these issues as early as possible. We think makes a difference.
So I would like to we're going to be discussing next month. I think we'd like to talk about long haul COVID. So just for everybody on here, we will be able to have both Dr. Jean Ronel and Dr. Paul again on next month, and we'll be talking about long haul COVID. And I think it's going to be a great call. We're not sure of the date yet, but we'll get that out to everybody. But get back to the person that put you on this call and say you're ready to get started. And if you want to hear this video, it will be put on YouTube under TeamServe, or any other videos, you can go there. But I want to thank everybody for coming on tonight and taking the time to learn a little bit more about PANS and PANDAS, but like really about, it's an infection driven, and we know, right, that PANDAS is from strep gram negative bacteria, but there's a whole host of other infections that could be driving, right? This neuroimmune response. So infections, we need to think about that can cause neuroinflammation. And so it's a new way of thinking about this. Any
Yes.
other comments?
Well, we also know that the digital world is important when we're looking at infections.
It's true.
And the fact that a lot of these bacteria really love RF frequencies and the kind of frequencies that we're surrounded by. And so that's where the digital hygiene comes in. And like I said, we're breaking new ground. We are pioneering and running down a new frontier where the world is saying more and more and more. And we're saying, no, we've got to get back to less and less and less, especially with these children that are super sensitive. They feel everything.
Yes.
So we are so grateful to both of you. We're grateful to Dr. Prasad. And thank you so much for being on our call, Jet.
Thank you. We
That's it.
appreciate it. Yeah.
And you know what? Start with digital hygiene. Let's just work in the bedroom, right? Let's just make our sleep space safe, cool, dark, remove all of that. Start with that. So it's not as much of a big issue during the day, because we know with work and other activities, that's harder to regulate. But the one place you have control over is your bedroom. And that is when you heal. So that's what we're going to end with.
Two simple things: unplug all the electronics in your bedroom and unplug the router, because that's a constant input throughout the night when we need to get restorative sleep and repair our brain.
All right. Thank you
Very
both.
sound advice.
Thank
Thank you.
you.
Thank you for that.
Thank
We
you,
appreciate that.
doctors.
And we'll see you all next
Pleasure.
time. Thank you. Yeah.
Be well.
Bye-bye.
Thank you.
so
Thank you, doctors.